Hello, I'm Dr. Wendell Bulmer, Chief of the Orthopedic Department at the Nucci Spine and Orthopedic Institute. My role is managing lesions and injuries to the upper and lower extremities. Dr. Nucci handles all the treatment of this neck and spine. My treatment would include both surgical and non-surgical approaches to injuries or conditions relative to the upper and lower extremities, which would include the shoulder, elbow, wrist, and hand. In the upper extremity. In the lower extremity, that would include the hip, knee, ankle, and foot. The most common procedure that I do is arthroscopy to the knee. The knee has soft tissue that acts as a cushion called the meniscus. We have a medial and lateral meniscus. This is the medial meniscus, this is the lateral meniscus. And at the time of injury, these can become torn. There can also be injury to the cartilage that covers the bone, which is called articular cartilage. Most common one is at the patella. You probably have noticed that with the crunching in your knees. We can treat this through the arthroscopy, which is a device that allows us to enter the knee through an incision that would allow this camera to pass. We put the camera in, we're able to look around inside the knee, where through another incision we enter, and with instruments that are small as well, enable us to finish or complete our procedure inside. We're able to examine the large ligament structures, and if there's disruption on the cartilage, we can clean that up as well. Now, there are times when we do surgery, we realize that we cannot fix everything through an arthroscopy. If the ACL, for instance, is torn, we would make an incision slightly larger, would use the arthroscope to assist with this procedure and reconstruct the anterior cruciate ligament. In the event of a severely injured knee where the articular cartilage is completely disrupted and we have advanced arthritis, a total knee arthroplasty may be required, which is a knee replacement, and that requires a larger incision, an open procedure, and a hospital stay. The arthroscopy procedures that I mentioned can be done on an outpatient basis through a small incision. The patient goes home the same day and begins walking the next day.